minute, Senator Hatch, that's not right.
Destroy the private health insurance.
The Congressional Budget Office did not say that. In fact, what they have concluded
yes, it did say
is that
yes, it did.
The CBO said that, in fact, those enrolled in private insurance plans would go up by 3 million, and they estimate that about 10 million people, only 10 million people, go into a public plan.
Well, didn't I say tens of millions of people? Others have said
that's different than 10 million.
Well, that's plenty. But others are saying up to 119 million people. It ranges in between. The point is, it's always more than what the government says it is. Look, I don't think people in this country believe that the federal government controlling everything is the best system of last resort. I think we should have more flexibility in the states to solve their own problems. For instance, New York is not Utah. Utah is not New York. We have a tremendous health care system that works out here. They don't in New York. Massachusetts has that so-called connector system. They now haven't added people over the last 2 years because they're almost bankrupt because of the cost of their government plan. If you go down through it, anybody that believes that the federal government is going to take this over and do a better job than the private sector, even with all the faults of the private sector, I think just hasn't looked at the last 30 years.
Senator Schumer?
I would just say this, yes. The problems, Orrin is right. Medicare costs are out of control. So are private sector costs. That relates to the fundamental problems in the health care system, and it's why President Obama feels we have to take this on. Because if we don't, both the public sector, Medicare, and the private sector, private insurance companies, insurance is going to become so expensive that people won't be able to get it. And it's not 20 years away, it's 5 to 10 years away. So it takes a lot of courage to take this on. What I would say is this. We need to get at these fundamental cost problems, and we ought to try different models. There is no mandate with the public option. That's one of the myths that's been put out here. It's like a college system. In New York State and Utah, there are public colleges, private colleges. You choose the one that's best for you, and competition makes both of them better.
All right, that's fine. You're arguing the merits of the public option, but I want to go back to where the president is. Senator Hatch said that the president realizes that it's a non-starter, certainly among Republicans, but Democrats as well. The Gang of Six, so-called, working right now on your Senate Finance Committee, they're not talking about a public option, and the president is saying publicly, look, it's just a sliver of reform. Is he not walking away in order to get some kind of compromise?
No, if you read what Mr. Gibbs said and others have said after Secretary Sebelius's comment, it's clear that they much prefer a public option. Obviously, we are going to try to get a bipartisan bill. But a public option to many, many objective observers is essential to bringing those costs down because it provides competition. And at the end of the day, we will have one. We will have one. Because I believe even if every Republican says that they will not be for a public option, we can find a level playing field, level playing field type public option where both insurance companies and this option compete. And we will get 60 Democratic votes for it.
Is that the idea of a co-op? Is that the idea of a co-op that operates in the states?
Well, a co-op is a little different because it's not set up by the government. It's set up by cooperators. But I think you need, in whatever comes about, and I much prefer the public option, you need three things. First, it has to be available on day one. This can't be triggered down the road 4 years from now as the private insurance industry just, again, in its very, very non-competitive way, continues to raise costs. Second, it has to be available to everybody. I know that Senator Grassley, my good friend, has this idea of 100 farmers getting together in Iowa and forming a co-op. That's great. But that's not going to help the rest of the citizens of Iowa or of New York or anywhere else. And third, it has to have the strength and clout to go up against the big boys, the big private insurance companies that actually run the show here. And they've been as responsible, if not more responsible, for runaway costs than Medicare has.
Senator Hatch, you're a good friend of Senator Kennedy's. You have walked away, in fact, from these negotiations with the Democrats. What impact is the loss of Senator Kennedy day to day on this compromise, this search for a compromise having?
Well, Senator Kennedy, first thing he would have done would have been call me and say, let's work this out. And we would have worked it out so that the best of both worlds would work. Now, just think about it. These people want to take and create a government plan when Medicare is $39 trillion in debt right now, and the way they're going to do it in both the House and Senate bills is they're going to take $400 to $500 billion to pay for this new plan out of Medicare. And not only that, they're going to set up an IMAC. It's called an Independent Medicare Advisory Council that's going to set just all the terms and conditions of health care. And that means rationing in anybody's language, and I think you've got to be concerned about that. Last but not least, we have 300 million people in this country. Let me finish, Chuck. Let me finish. We have 300 million people in this country, 85% of whom have health insurance. The other 15%, you've got 6 million people who actually qualify from their employer but don't get it. You've got 11 million people who qualify for CHIP and Medicaid. You've got another 9 million people who earn over $75,000 a year, can afford their own health insurance, but won't do it. You've got 6 million people who are illegal aliens getting health insurance. When you bring it down, that 47 million people comes down to about 15 million people. So we're going to, and we all know we need insurance reform, both Democrats and Republicans, but we're going to throw out a system that works for 85% of 300 million people, to take care of 15 million people that we could take care of with subsidies and other approaches. It would be simple.
Senator Schumer,
I would never go to a federal government program. If we do that, we'll bankrupt the country.